Hey everybody, it's Dr. Frants. Today I want to talk about lower eyelid surgery. If there is a bulging appearance of the lower eyelid, this is usually a result of weakness in the orbicularis oculi muscle, which is a round muscle that is around the eye, helps you close your eyes. And so when the portion of the muscle weakens and the fibers have little gaps between them, the underlying fat pads are able to herniate or protrude between those muscle fibers. In contrast to the upper eyelid, where we have two fat pads, two, and an outer lacrimal gland, in the lower eyelid we have three fat pads. And so when assessing lower eyelid, it's really important to pay attention to which, it might be all three fat pads are herniated or excessive, sometimes one more than others, and so it's really important to make note of this. And the solution for this is to shrink down those fat pads. Now, in the lower eyelid, if you have a really prominent what's called a tear trough groove, which is this line, it's a line that correlates to where the muscle, this round muscle, inserts onto the bone. And if you have a really deep groove there, but you also have a bulge above it of the fat, then this might be a situation where the best option is to take down that bulge, maybe trim the fat, but ideally reposition it and take that excess fat and actually slide it into that depressed groove. So how do we do this? There are two general approaches to this. One is through an incision underneath the eyelid through the skin, where we can access the fat and we can trim it or reposition it. And the other option, which I am a really big fan of and I really like to perform, is called a transconjunctival lower blepharoplasty with or without fat repositioning. So let's break it down. Transconjunctival means that the incision is actually placed in the conjunctiva, which is on the inside of the lower eyelid. There is no external incision in this case. We make an incision through the lower eyelid conjunctiva. We access the fat that is bulging out, and then we isolate each fat compartment depending on which one needs to be trimmed. And then we can recontour the fat and we can actually reposition that fat and advance it into the areas that are hollowed underneath. And then last thing with lower blepharoplasty is sometimes we also perform some fat grafting where we harvest fat from the abdomen, and then we can graft that fat into any area around the eyelid that is necessary to really optimize the appearance and optimize transitions and contour of the lower eyelid. It can also be used in the upper eyelid as well. If you feel that your brow is in a suboptimal position, please reach out to me and I'd be happy to discuss which surgical option is best for you. Thanks.